name is Chris Smith, and I will be presenting a demonstration speech, CPR. CPR, or otherwise known as cardiopulmonary resuscitation, is a technique that, when applied correctly and by someone properly trained, can be the difference between life and death. And in my line of work, I'm actually required to be CPR certified. CPR is to be administered if someone is unconscious or if you notice that the individual is no longer breathing. Now here's just a little bit of history about CPR. It was actually introduced in the 19th century by Dr. H.R. Sylvester. Now the first method was actually named after him, actually called the Sylvester method, and it varied slightly from the current CPR methods. It actually had the victim lying on their back, their arms raised above their heads to aid in inhalation, and then pressed against their chest to aid in exhalation. Now over the years there have been many revisions and various techniques used in order to resuscitate. But for the most part, all of the different methods are very similar. Now when you first notice someone unconscious and no longer breathing, be sure to check the environment around you first and use your own personal judgment to ensure the safety of not only yourself, but for the safety of others as well. Now after you check the scene, you definitely want to send someone to call for help, preferably to call for 911. You never want to leave the victim unattended during this stage. After you have sent for help, you begin to care for the victim. Now according to the American Red Cross's First Aid CPR for the Workplace, here's the proper way to administer CPR. First, you place two hands in the direct center of the chest, preferably on the lower half of the sternum, compressing 1.5 to 2 inches. That's for adults. You can press 30 times and then tilt the head back, hold the nose, and then blow 2 breaths into the victim's mouth. Now while you're compressing, be sure to use your body instead of just using your arms. Because if you just keep your arms straight while compressing, this will ensure that you are going to use your entire body to avoid fatigue. You perform CPR on children and infants in the same way as you would as on an adult, but the only difference is the amount of pressure that you use to compress. CPR is only likely to be effective if started within the first 6 minutes after the blood flow stops, because after that time, the cells of the brain become dormant. This has been a demonstration. Now I'm going to give you a proper demonstration of how to do CPR. Notice how I'm keeping my hands straight, so I'm not using, just my arms. You want to use your entire body when you're compressing. This has been a demonstration of CPR. Thank you.
Just the arm got down the way a little bit. I don't know if it's in the way. We at 3.5 minutes, though.
Okay. It's not bad. Did I do pretty good?